Thank you. I know that we have a lot of folks watching here across Long Beach, and I'm Mayor Robert Garcia, and we've been doing regular updates, of course, just to the community. These are really community briefings as they relate to COVID-19, the coronavirus, and so these have been pretty regular, and they'll continue to be regular as well as we try to get you the most important information, accurate information to everyone across the city and the community, and also answer any questions that may have come in from members of the media so that we're informing them as well of what any issues that there might be. I am here today with Dr. Davis, who will also be giving some remarks as it relate to public health. Dr. Davis is really leading our health efforts here in the city of Long Beach through the Long Beach Health Department. And we're very, very grateful to her work and the entire team's work across the city. And we'll also have, after I say a few remarks and give an update, and after Dr. Davis gives her update, at that point, then we will also have some translation. And so we will translate that also into Spanish, and then I'll close after the Spanish translation. And we have Leslie from the Long Beach Health Department who will be doing some translation for those that want to see the remarks in Spanish as well. Well, again, welcome. I want to just thank, on behalf of the city of Long Beach, I just want to just begin by thanking the entire community for their really incredible support. I think a vast majority of the community is doing the right thing. They're following the governor and the city's orders as they relate to what we're expecting the community to do and not do. And I want to begin today by letting folks know that unfortunately and sadly, we have confirmed the first death from coronavirus, from COVID-19 here in Long Beach. We share this, of course, with a heavy heart. The patient was a female. She was in her 50s, and she already had some health conditions. And as we know, COVID-19 is especially more dangerous for people with health conditions, with low immune systems, with respiratory challenges. And so our thoughts, of course, our love, our prayers are with her family, her friends, and anyone that really has connected with her. We cannot release further information at this time just to protect confidentiality for the family and really because it's the law as well as what we can release and can't release. But we just wanted everyone to please know that this is a serious public health emergency. We did have our first death. As we all know, we have more cases every few days, and I know Dr. Davis will speak to those later in just a minute. But we remain committed to getting through this challenge. And I know you know that together, working together, listening to what is going to be broadcast today is really important, especially over the next few 2 to 3 weeks. I want to begin by reminding everyone to take the health order, our safer at home order, very seriously. Our local order aligns with the County of Los Angeles, and it aligns with Governor Gavin Newsom's statewide order as well. So what does that order say, and what should folks watching be doing? The most important part of the order is if you do not need to leave your house, please stay home. If you do not need to leave your home, please stay home. I can't express how important it is from a community health perspective that we flatten that curve and we keep as many people home as possible. We also want to make sure that as people are staying at home, that we've heard this before, I say it again, wash your hands continuously. Please cover your mouth if you cough. Stay at home if you're sick and contact your local physician or doctor. And the order is also clear. We know that there are essential businesses which are allowed to remain open, and those essential businesses include restaurants that can do to-go and pick-up delivery. They include health professions that are frontline workers to try to take care of the situation that we're in. They include groceries and markets, so people have access to clean foods and to foods. And they also include some critical infrastructure type of businesses as it relate to homes. So if there's a critical electrician or a plumbing incident, or if it relates to hardware for your home. We know that they are also essential during this time. Construction, in most cases, is essential because we know at the end of this, we are going to continue to be in a housing crisis even larger than the one that we were in right when we started this health crisis. And so please, again, if it's non-essential, please try to stay home. In addition to that, what does safer at home mean? It means that we have now closed a variety of facilities: tennis courts, basketball courts, golf courses, dog parks, playgrounds at parks, picnic areas, and any type of group exercise activity outside in our parks, beaches, or bluff areas are not allowed, period. And so please follow that order. If you do not need to be outside, please do not do so. And while the order does allow people to walk to and from locations, you're able certainly to walk through a park or walk or ride your bike down the coast. Those things are still ways of getting around. You must still practice the social distancing rule of being at a minimum of 6 feet away from the next person that you are with. So please practice those laws. And as we move forward and as guidelines get more and more strict, our police and public safety officials are doing everything they can to ensure that people are complying, but we need people to self-regulate themselves as much as possible. As a city, we've also done the following, which most are aware. We have canceled or postponed most events. There's no need for events right now. We shouldn't be planning events, even things like casual parties with friends, getting together with a group of friends or family. Those are not necessary essential types of movements, and I would encourage you not to do those and to stay home. We also want to note that along with that, the Long Beach Unified School District has announced that they will be at a minimum closed through May the 4th, and Long Beach City College and Cal State Long Beach have transitioned to online coursework. Want to make sure that people know that the messages we're giving today and throughout the days are being translated as well to Spanish, Tagalog, Khmer, and ASL, and you can find those on our longbeach.gov COVID-19 webpage. All you need to do is go to longbeach.gov and all the information is right there. Want to make sure people know, I think that we know that as the end of the month nears, people are starting to get nervous and people are starting to get worried about the rent, about mortgage payments, and about bills. The city has already adopted some relief, economic relief, but in the days ahead, you will hear more from the state and the Congress about what federal relief is coming directly to workers. But for now, locally, please know that we're not going to turn off your utilities if you can't pay. We're not going to turn your water off. We're not going to turn your gas off. Your utilities, even if they're from a private provider, will not be turned off. You cannot be evicted during this time if you've had or lost wages or are unhealthy because of COVID-19 or have not been able to go to work. You will not be evicted from your home or apartment. That's been a law that the City Council has adopted. And we have people standing by 7 days a week to help you file for unemployment and for job support. If you need to help to file for unemployment, you can call our number at 570-3700, or you can go to longbeach.gov on the COVID page, and there's a link for businesses and for unemployed workers. But again, you can call that number. If you are a business, you can call 570-4BIZ, 4BIZ, if you need assistance with any type of job or small business loan or support. So please take advantage of those. I now want to talk some about parking. A lot of people have been asking questions about parking relief as it relates to street sweeping, and citations. Just to be clear, we have extended our moratorium on giving tickets as it relates to street sweeping for another week. And so so this entire week, there will not be tickets giving as it relates to street sweeping. And we know this is important for parking impacted neighborhoods. We also did this last week. However, I think it's really important for people to know that other types of citations, if you park in front of a fire hydrant, if you're parking in a handicapped zone, if you're parking in a red zone that we need to keep clear so our firefighters and paramedics can get in and out, those are still all open to receive citations because it's so critical. Those are tied to public health and emergency services. So please respect those parking laws, but know that if you can't move your car because of this health crisis, you're not going to get a ticket around street sweeping. If you can move your car, if you're not in an impacted neighborhood, please move your car so we can come by and street sweep. We are still street sweeping. We just are not ticketing if you can't move your car, just to be very clear. But there is going to be a change to this. And we really need people to know that normal street sweeping operations and enforcement will resume 1 week from today on Monday, March the 30th. Why are we doing this and why is it important? Street sweeping is a critical public health and storm management function. And so while we have pushed street sweeping back, and we would love to not street sweep and let people keep their cars in their locations indefinitely until this is over, we can't for the health and well-being of the entire city. 2 reasons. Number 1, we have to clear the streets because debris and trash becomes a public health issue, and so streets must maintain clean. And there's a second important reason, especially if you live in parking impacted areas like Alamitos Beach and others. We have storms and rains ahead. We have to clear the gutters and we have to clear all of the streets. And if we don't clear the gutters and ensure that all the cars are gone, we are in danger of now not just having a health emergency, but a flooding emergency. And we don't have the capacity to then get our public safety folks clearing streets, clearing gutters, and flooding large parts of the city. So I repeat, 1 week from today, we will resume enforcement and citations. However, if you are in a parking impacted area, we're here and trying to help. We have opened up a significant amount of parking lots, free for residents to move their car anytime this week and get a free permit to move their cars. These are lots across downtown and our beach lots up and down the beach, and we're continuously looking for more lots. And please, again, if you go to longbeach.gov, there's information there. There's also a website or an email you can email today to get one of these citations. You can email longbeach@lazparking.com. longbeach@lazparking.com, and that should get you to the right person, but you can just go to longbeach.gov and find that. But again, you are able to get a parking spot. Let me add 2 final things, and then I'm going to turn this over to Dr. Davis. I want people to know, and these are really important. Over the course of the next 2 to 3 weeks, we're entering a very critical time for the city, for our hospitals, and for emergency services. We are, as you know, seeing an increase of cases, and we are seeing an increase of people who need medical attention and who need respirator machines, not just in hospitals here locally, but across the country. I'm in conversation with the heads of all 4 of our hospitals here in Long Beach. Their message to you and my message to everyone watching, your family, your friends, is you need to please stay home to help us minimize people being infected and filling our hospital rooms when we need those hospital beds clear and empty. In this next 2 to 3 weeks, we are either going to stay home, try our best to stay healthy and social distance, or we're going to fail at that and fill our hospitals into an emergency point where we will not have enough beds to be able to treat everyone that needs support and that needs a hospital bed. So I'm asking you to please be responsible and think about our doctors, our nurses, and our frontline workers at our hospitals and clinics that are asking you to please stay healthy so that we can keep our hospital beds free for what we know will be a larger amount of people every day moving forward over the course of the next 2 to 3 weeks. So you must think of these next 2 to 3 weeks as critical times to do the right thing. So please do the right thing. And then the last thing I will say is, as I've mentioned before, we have launched an emergency relief fund for low-wage workers, for parents that might need support, for people experiencing homelessness, for vulnerable people in our community. The Community Foundation of Long Beach, partnering with the City of Long Beach, have launched the Coronavirus Relief Fund, and you can text today at 50155, text support LB to 50155 and give $5, $10, $25, whatever you can, and support these vulnerable groups. I think I have mentioned before that when we launched this last week, we have already raised hundreds of thousands of dollars, and with your support, we can continue to raise more for these vulnerable populations. And so thank you for that. I want to turn this over to Dr. Davis, who is going to give us more details on where we are from a health perspective as it relates to our patients and our testing ability. Dr. Davis.
Thank you, Mayor. In the Health and Human Services Department, our job is to preserve and improve the lives of the people of Long Beach. It's devastating to have lost someone to this new disease, and our thoughts are with her friends and family. While every day we're learning more and more about this new virus, there's still a lot to learn. From what we know now about COVID-19, we've seen that greater than 80% of people infected will experience mild to moderate illness, like a common cold, all the way up to a really bad flu. 15% of those infected will have more serious illness and may require hospitalization. They may have pneumonia, or they may need oxygen supplementation. And approximately 5% may require intensive care. COVID-19 has the potential for devastating and disruptive effects in our community because it's so new, and so everybody is susceptible, and there's no vaccine or medications available at this time. On March 20th, the state issued new guidance for COVID-19 testing prioritization. Testing will continue to be based on medical need and will help ensure that those people at the greatest risk and who most need testing will have access to testing with results in as timely a manner as possible while reducing strain on the healthcare system. The most significant change in these recommendations is that those with only mild respiratory symptoms, who do not otherwise need to seek medical care, and who are not in one of those known high-risk groups should not be routinely tested for COVID-19. These people should care for themselves at home as they normally would for a mild illness, and take special care to stay home and away from others while they are contagious. So a good rule of thumb is to think about your current symptoms and take 1 year back. So if a year ago you would have had these same symptoms, and at that time you would have just stayed home and not sought medical care, that's what we're asking you to do right now. We're asking you to do the same thing right now. If you have these mild symptoms and you get tested now, you're potentially exposing more people as you receive the testing, and it's not going to change your management. It's not going to change what doctors suggest that you do. If you're sick with respiratory symptoms, what we recommend is to stay home for 7 days until your symptoms are improved and you've gone 3 days without a fever and with no fever medicine. We have been and we continue to work day and night, 7 days a week, to help limit the spread of the virus, but we won't be able to slow things down unless the public does their part to help. So stay home if you don't need to be out. Practice social distancing. If you do need to leave your home, maintain at least 6 feet between you and others. Avoid touching objects and surfaces in public with your hands. When touching things is unavoidable, don't touch your face until you can wash your hands with soap and water for at least 20 seconds. Limit gatherings with people besides those you live with to the greatest extent possible. Use virtual hangouts instead. Try to avoid any unnecessary face-to-face interaction, even in small groups. We're depending on our residents to follow these orders. We cannot fight COVID-19 without your help, and these actions will also help the strain on the healthcare system that the mayor was highlighting. We know that what is happening can seem scary and can cause a lot of fear in the community. Do what you can to attend to your mental health. Connecting with family and friends by phone or video, enjoying some outside air while maintaining your social distance can be helpful for your mental health. There are also resources online that can help, such as online therapeutic services. You can find more information on COVID-19, including the Safer at Home order, prevention information, and other resources at www.longbeach.gov/COVID-19, or call the public health info line at 562-570-INFO. That's 562-570-4636. Thank you.
Thank you. We're going to just answer a few questions. Some we've already answered, and then we're going to do a Spanish translation for those that need Spanish translation. I know, Dr. Davis, the latest number on how many positive cases we have on COVID-19, I believe, is up to.
We're at 21 now. We've had the one death. We've had 4 of our patients are hospitalized, and 5 have cleared. And we are right now monitoring, altogether, we've monitored and are currently monitoring about 190 people or contacts.
And so we're monitoring about 190 people, and I know we have 21 confirmed positive cases as of right now. Is that correct?
Yep.
Okay. And I think the important thing on that issue for a lot of, there are a lot of folks that are asking me questions online or are asking about testing and are asking about, when is mass testing or drive-through testing going to happen and the process. And I think what's really important for people to know is that the city of Long Beach and the county of Los Angeles and our region, we are testing right now as much as our capacity allows us to. And what I mean by that is there is, as you know, every city health agency in the country is waiting for more testing, more kits to come in from the CDC and other places. Some of our hospitals and private labs are doing this work as well. But when someone asks, why aren't you testing more? My response is, we would love to test more. We would love to be doing drive-through testing across the city. There's just not the amount of tests that we need, that we don't have enough tests to be able to do all of the need. And so what is happening, not just in Long Beach, but across the country, is our health department, LA County Health, City of Los Angeles, through the health department, all of our partners have a unified system of who gets tested and when they actually receive a test. And then that goes to a lab for results. And so there is a strict process, and there's guidelines that our doctors and our health professionals are following that align with the national guidelines. And we know that more tests are. We obviously are hearing our federal partners and leaders say that tests are on the way, and we are actively, anxiously awaiting for those to arrive. And so we look forward to that. And when the second that we have enough tests to do the type of testing that people are asking for as it relates to drive-through testing or walk-up mass testing, within seconds we're ready to go and set that up. We're ready to, we have the locations, we have the tents, we have what we need. We're just waiting for the tests. So I just want to make sure people know that. And then the other question that we got from someone from the media was, what are we doing around enforcement? And what I will say is, what our police department is asking the community right now to do is to please help us just follow the order and the laws. We are not right now trying to go out and burden everyone with tickets. The police department are busy guarding critical infrastructure, taking care of the normal types of things that police officers do on a daily basis that we were doing before the crisis happened. And so I ask all of you to just follow the orders, follow the law. You can receive a citation or a ticket for breaking the order, but it's more about education. This is an educational campaign right now that the police department want people to help each other and support each other to follow the laws. And with that, I'm going to have Leslie do a short translation. She's going to get the key points of us in Spanish so that folks in Spanish can also hear these points. And thank you very much, Leslie.
Muy buenas tardes. Como el alcalde Robert Garcia dijo en inglés, el Departamento de Salud y Servicios Públicos de Long Beach ha confirmado la primera muerte de COVID-19, también conocido como coronavirus. Compartimos esta información con mucho dolor. La paciente era una mujer en sus 50 años con problemas de salud preexistentes. Nuestros pensamientos están con los seres queridos y amigos de la residente que falleció. No se compartirá más información para mantener la confidencia de la persona y permitir que la familia tenga su luto. Seguimos comprometidos a poner fin a esta emergencia de salud pública y continuaremos trabajando fuertemente para que la prevención para la prevención de más muertes. Por eso es que le recordamos que todos tenemos que seguir las reglas de Safer at Home, que quiere decir más seguro en casa, y las tenemos que tomar muy en serio. El alcalde acaba de decirnos que tenemos 29 casos positivos, 4 personas que están hospitalizadas, 5 personas a las cuales ya no tienen síntomas y como habíamos dicho, una persona que ha fallecido, más 190 casos que seguimos investigando. Contactos que seguimos investigando. En cuanto a nuestra parte, hemos empezado a cerrar parques y también gimnasios, al igual que lugares más públicos para asegurarnos que las personas se mantengan en su casa. Es importante saber que todos los residentes y visitantes de esos residentes tienen que mantenerse en su casa, practicar higiene, lavarse las manos para asegurarnos de que no contractan el virus. Y también queríamos hablarles de los desalojos. Ahorita no tenemos personas, no estamos dejando que haya desalojos, hay un paro en eso. También las utilidades van a estar paradas donde no les pueden cortar su gas ni su electricidad. El estacionamiento hasta esta semana no van a estar dando multas, pero empezando el lunes, marzo 30, van a empezar otra vez las multas. Se tienen que asegurar que ya no se estacionen en los lugares donde va a pasar la barredora. También tienen que asegurarse de que no se estacionen en lugares donde está marcado como rojo o azul para las personas que tienen disabilidades. La ciudad de Long Beach sigue trabajando fuertemente, trabajando con el distrito escolar de Long Beach, la universidad y el colegio. La doctora Davis del Departamento de Salud de Long Beach nos dijo que cada día aprendemos más de esta enfermedad, pero realmente todavía nos falta más. Lo que sí sabemos hasta ahorita es que más del 80% de las personas infectadas experimentan una enfermedad leve a moderada. El 15% de los infectados tendrá una enfermedad más grave y puede requerir hasta hospitalización. Y aproximadamente el 5% de los casos pueden requerir cuidados intensivos. COVID-19 tiene el potencial de tener efectos devastadores y perjudiciales en nuestra comunidad porque es nuevo. Por lo tanto, les repetimos que es necesario que se queden en casa y se laven las manos. El 20 de marzo, el Estado emitió una nueva guía para el COVID-19. Las pruebas es para obtener más pruebas, porque como dijo el alcalde Roberto Garcia, estamos en escasez de pruebas. No se pueden hacer pruebas a todas las personas, sino tenemos que seguir las guías que nos da la CDC. El cambio más significativo es que las personas que tienen síntomas respiratorios que son leves las cuales no necesitan atención médica y que no están en uno de los grupos de altos riesgos, no deben someterse a pruebas rutinarias para detectar COVID-19. Hemos estado y seguimos trabajando 7 días a la semana, día y noche, para ayudar a limitar la propagación del virus. Pero no podemos mejorar las cosas a menos de que el público nos ayude. Por favor, quédense en su casa, sigan lavándose sus manos y también practiquen distanciamiento social. Si necesita salir de su hogar, manténgase a 6 pies de distancia de otras personas. Evite tocar objetos y superficies en público con sus manos cuando cuando no puedan evitar eso, asegúrense de usar hand sanitizer o gel para limpiarse las manos. La mayor medida limite la reunión con otras personas y nosotros sinceramente esperamos que los residentes sigan las guías que les da la ciudad para bajar la transmisión del COVID-19. En nuestra página web www.longbeach.gov /COVID-19 pueden encontrar más información sobre COVID-19. También encontrará información de prevención y más acerca de la orden quédense en su casa, más protegidos en su casa. Repito otra vez, la web es www.longbeach.gov /COVID-19. También pueden llamar a la línea de información 562-570-4636.
Gracias. Y muchas gracias también para todos que están mirando. Estamos trabajando bien duro en esta crisis y por favor escuche a las direcciones de la ciudad y del gobierno del estado. And again, I just want to thank everyone for watching and our entire health team who's doing a fantastic job in the city. And again, we do, our love goes out to everyone right now that is suffering throughout this. We know there's a lot of impact. It's really devastating for businesses and workers and families, but we're going to continue every day to do the best job that we can to get past this. And if we follow directions, take care of each other, show compassion and kindness, we'll get past it as well. So thank you very much.